I'm Carlos Jimenez. I'm the mayor of Miami-Dade County, and it was a pleasure for myself and Commissioner Rebecca Sosa to have a briefing along with other state and local government officials about the Zika and the Zika issue here in Miami-Dade County, and also what's happening around the state of Florida and around the world. It was very informative. But I want to assure everybody in Miami-Dade County that we have no locally transmitted cases of Zika. We have a robust prevention program here in Miami-Dade County. We also would hope and would appreciate the help of the federal government. I understand that there is some money being allocated for Zika at the federal level, and we discussed that with the senator. Hopefully Miami-Dade and other areas that can be affected by Zika because of our climate would get the majority of those dollars. And so at this point it was a lot of information. We are doing a lot of the things that the experts are saying we should be doing. There's no cause for alarm. Again, there have been no locally transmitted cases of Zika. Everything has been transported in. But we know that we are, the capital, the gateway to the Americas, and so we have a lot of people that will be traveling from this area to infected areas and coming back. We want to make sure that we have a robust prevention program, but also a robust educational program for our citizens so that Zika does not become a problem here in Miami-Dade County. Thank you.
Good afternoon, everybody, and Senator, thank you, because when the federal government, the state, and the local governments work together to make sure that the safety of our community is our #1 objective, is when things get done. And what we want is to make sure that with your help, your assistance, the funding comes to places that can be used to prevent any big problems to happen in the future. So I really ask you for your support to make sure that the federal funding comes to places where they are needed. And thank you to the mayor, because we will be able to educate the community, tell the community the reality. Everyone comes to Miami-Dade County, everyone leaves Miami-Dade County. And right now, we are making sure that we don't have big problems in the future, so the future of those children are safe and secure. Thank you.
Thank you, Commissioner, and thank you, Mayor, for attending this briefing, and I want to thank all of you for covering it. So the purpose of this today, as you know, is the world is being deeply impacted, particularly the Western Hemisphere, by the Zika virus. And so we want to ensure that we in the United States are prepared to address this as this issue develops. And in particular here in Florida and in South Florida, where there are two elements that we are obviously aware of. The first is that people come here and they like to be in South Florida because it's warm. But warm temperatures are also a contributing factor to the spread of mosquitoes, which of course can lead to infection. And the other is we have a lot of travelers. We are literally and figuratively the gateway to Latin America and to many of these countries. As we prepare for the Olympics, for example, this summer, the number of people coming in and out of our airports and seaports is going to incrementally increase. And as you've seen, most of the Zika cases that we have here in Florida, in fact, not all of them, except for one, have been those which have been transmitted elsewhere and have been imported into the United States. And so we want to ensure that the government is doing what it needs to do as its part to keep an order in public safety with regards to this issue. From the federal perspective, the President has proposed, and I support the spending of $1.9 billion to help our local and state jurisdictions address what needs to be done on this issue. I had asked the President, along with others, that about $500 million of unspent Ebola money be repurposed for Zika. The President announced that they would do so this week. There, of course, remains an unallocated fund, and we'll be working towards achieving that. But the real purpose of today's meeting is to ensure that as the federal government spends $1.9 billion of taxpayer money, that money is being spent in the right way, on the right things, and in the right places. As we've seen oftentimes in the past, like after Hurricane Sandy, you all of a sudden find that areas around the country that had nothing to do with Hurricane Sandy were receiving part of that money because they had a politically powerful senator or congressman that were able to get their hands on some of that money. If we're going to spend $1.9 billion addressing the issue of Zika, it should be spent on addressing the issue of Zika. And so the reason why we're here today is to ensure that we know clearly what the needs are at the state and local level so that those priorities are being funded. In that realm, there are 4 areas that we concentrate on. The first, of course, is the need for improvements in our diagnostics and the ability to diagnose and quickly identify who has been potentially impacted by this. And so there are things we can do through the Center for Disease Control and Health and Human Services to improve the availability of diagnostics for patients, particularly at the point of treatment, at the point or in a doctor's office, or quickly thereafter. So someone who may be potentially impacted by this would know that they are a carrier. The second is the need for vector control, or do we call mosquito control. And that's an ongoing issue. And we've talked about, we're not going to get rid of mosquitoes. They've been here before mankind was to walk the earth, and they'll be here for a long time. So we're not going to wipe out every mosquito in the world, but we are going to have to deal with it, and there are things we can do in government to ensure and assist with that. The third is, of course, the hope that we can develop a vaccine. That would be the ideal outcome. And to ensure that sufficient federal funding is going to the NIH and other agencies that are providing the basic research necessary to ultimately commercialize a vaccine, so that this Zika virus can go the way of so many other issues that have impacted people throughout time. But I think the most important message today, there are two very important messages. The first is there's no crisis. This is an issue that we're going to confront. We want to get ahead of these issues. The best way to confront something is before it becomes a crisis. You prevent it. We know how to do this in Florida. We know how to do this in South Florida. Because we are a gateway community, anytime there is an outbreak of anything, from dengue to Ebola, we're on the front lines of it, and we take steps to address it, and we're doing that again. And I have full confidence in our local and state officials' ability to address this issue, particularly if they're properly resourced. But the other message is government can't solve this problem all by itself. The majority of the work that it will take to ensure that we can protect our people is on people. Meaning, make sure that your pool is not going green and it becomes a breeding ground for mosquitoes. Make sure that when you're going out, especially in the mornings and in the evenings, you're using not just sunscreen, but you're using mosquito repellent. Make sure that you're protecting yourselves. Make sure that if you travel to a part of the world that's been impacted by this, that you're being screened to ensure that you're not a carrier, so you don't infect a partner. Or perhaps, and most certainly, if you're pregnant, make sure that you're going to your practitioner and getting the advice that you need about future travel and so forth. I think a lot of this is about going to people and saying there are simple, common sense things you can do, not just to protect yourself from Zika, but to protect yourself from any mosquito-borne illness, which has confronted mankind forever. And so that's our hope here today, is to create both awareness, a sense of understanding that your government officials are involved in addressing this issue in a responsible way. And I want people to know that while I'm supportive of fully funding the President's initiative on this, I want to make sure that the money, when appropriated, will be appropriately spent on what we're trying to address here. Brevemente en español le doy las gracias al alcalde, a la comisionada y a todos los oficiales que estaban con nosotros en el día de hoy. El propósito de esta reunión es hablar sobre el tema de Zika. No es una crisis. Aquí en los Estados Unidos tenemos personas afectadas por esto, pero la enorme mayoría, es decir, casi todos los casos menos uno, fue una transmisión que ocurrió en otro país y entró acá. Y obviamente estamos enfrentando esto para que no se convierta en una crisis. El gobierno federal y el presidente Obama propone 1.9 millones de dólares de fondos para utilizar, para confrontar este tema del Zika. Yo apoyo esa iniciativa, pero quiero asegurarnos de que ese dinero, que esos fondos del contribuyente, se van a dedicar a este tema. Es decir, que no vamos a leer que 2 millones de dólares, 5 millones de dólares fueron utilizados en otra parte del país que no está enfrentando este problema. Yo creo que los gobiernos locales, el gobierno estatal de la Florida, es un gobierno que tiene experiencia lidiando con temas como este. Y tengo confianza que están lidiando con eso en este momento. Pero también tenemos que entender que la enorme responsabilidad también cae sobre los hombros de las personas que están viendo esta conferencia de prensa, nuestros ciudadanos y residentes, que tienen que protegerse ellos mismos. Si tienes una piscina que no estás cuidando, esa piscina se va a convertir en un nido para los mosquitos. Si debe utilizar lo que existe para protegerse sobre los mosquitos, tiene que tomar medidas. Si estás en estado, es importante que vaya a ver a su médico, y si va a viajar, es importante protegerse más que nunca. Así que el propósito de esto es crear un ambiente de que estamos trabajando sobre esto. No es una crisis, no es causa para pánico, pero sí hay que trabajar para asegurarnos que no se convierta en un problema más grande de lo que tiene que ser.
Senador, en español podría repetir, por favor, el monto de dinero que usted está apoyando y cómo sería manejado aquí en la Florida. De pronto el alcalde nos puede agregar a eso, o en el sur de la Florida en particular.
El presidente Obama propone utilizar 1.9 mil millones de dólares para lidiar con el tema del Zika. Y yo quiero asegurarnos que ese dinero se está utilizando para este tema. En el pasado hemos visto que cuando dinero se del gobierno federal, por ejemplo, se dedicó al huracán Sandy. Un porcentaje significante de ese dinero fue divertido a otras partes del país que no fueron afectadas por esa tormenta. Y lo que yo quiero asegurar es que si vamos a utilizar 1.9 mil millones de dólares de dinero del contribuyente para Zika, que el dinero se utilice para Zika y no para otros temas que un congresista o un senador poderoso pueda apoderarse de ese dinero para otro uso. Y segundo, quiero asegurarnos que si nosotros vamos a utilizar estos dineros federales, que se están utilizando para los programas y las iniciativas necesarias, que nuestros oficiales local y estatal están trabajando en este tema. No están en Washington en una oficina, están aquí, lidiando con este tema día a día. Y queremos asegurarnos que esos fondos se están utilizando para los propósitos necesarios y para las iniciativas importantes sobre esto.
Senator, some of the...
Thank you very much for the detailed briefing on the Zika situation, a serious matter. Obviously, there's another matter that's under scrutiny here of late, that is the upcoming GOP presidential convention. You were the only candidate who has suspended his campaign, yet requested that your delegates remain in pocket. What do you intend to do with those delegates completely?
I want to make sure they don't have Zika. Look, I'm focused 100% on my job in the Senate and the next 9 months that I have remaining representing the state in Washington, D.C., and that's the 100% of my focus. As I said, I'm not going to discuss the campaign here today. I don't have anything to add to what I've already said with regards to that, other than to say that our focus right now, 100%, is on finishing strong my term in the U.S. Senate over the next 9 months and ensuring that we can do important initiatives such as this and some of the other legislative proposals that I'm pursuing, and that's what my entire attention is on.
But if I may, why, Senator, have you asked that your delegates be kept in pocket?
Yeah, I don't have anything to add further than what I've already said with regards to that issue. So as I said, I'm focused 100%, and that's on our work here in the Senate, and that's the purpose of this conference here
Senator,
today,
do you expect, good afternoon, do you expect a contested Republican convention?
Michael, I'm 100% focused on my job in the Senate. I mean, that's what I'm focused on right now. I haven't given any thought to that issue, spent no time working on it. And the purpose of this conference here today is to discuss our work with regards to Zika and $1.9 billion of federal money. $1.9 billion sounds small for purposes of a $3 trillion budget. That's a lot of money, and we want to make sure it's being spent appropriately, especially in a community like South Florida that's going to see thousands and thousands of visitors to and from Brazil and other countries that have been deeply impacted by this. This is a serious matter, and we want to ensure that if we're going to spend $1.9 billion, that it's being spent on Zika and that it's being spent in effective ways in coordination with our partners at the state and local level who are dealing with this on a regular basis, not just sitting behind a desk somewhere reading reports.
Senator Rubio, what can you do to help increase funding for vector control in Miami-Dade County, where we have the greatest number of Zika cases in the state that leads the nation in total Zika cases? And you said that you support the President's request for the $1.9 billion. What steps have you taken personally to try to help that along and get your fellow members of Congress to approve it?
Well, the first thing is we want to ensure that the President, we want passing a spending proposal out of the U.S. Senate is not something you can do from one moment to the next. It takes time. There was about $500 million of unspent Ebola money. We wanted to make sure that money was repurposed so that it can be spent immediately. And that's not been achieved. The President announced 2 days ago that that's what they're going to do. And I spoke to Secretary Burwell yesterday, and so we had some preliminary discussions about how some of that money should be focused. Beyond that, we want to make sure that if there's any additional funding that's needed immediately to immediately address this, that perhaps that can be done in an expedited process. Going beyond that, through the normal process of how the Senate spends money and the House does it in Congress, I want to ensure that I work with my fellow Republicans in both the House and the Senate to ensure that we're doing everything we can to get my colleagues to be supportive of it. And one of the best things that I can do to achieve that result is to be able to go back to my colleagues in the House and in the Senate and represent to them that not only is this money going to be spent on Zika and only Zika, but that it is going to be spent appropriately on programs that actually work. And one of the things that we should ultimately aim towards is investing the necessary resources through NIH for the basic research that we need to develop a vaccine. Because if we can develop a vaccine for Zika, your Zika problem, at least here in the United States, becomes much less of a factor. And so, but the most important thing I can do to help get the support of my party to support this initiative is to be able to go back to them and say, not only is this money going to be spent wisely, it's going to be spent only on this. It's not going to be a gravy train for all sorts of other initiatives that have nothing to do with Zika. because that's what's happened in the past, and that's how these things go off the rails.
Miami-Dade vector control spending per person pretty low compared to other parts of the state.
Yeah, I don't think that's a fair analysis. I don't think it's a fair analysis for a couple of reasons. Number one, some of these other jurisdictions in the state have independent mosquito control districts. They have their own funding mechanism. The other is, I think the mayor's been very clear, and I'll let him answer for himself, that funding is not the issue. If they need to spend more money, they will do it. He has ordered them to go ahead and do whatever needs to be done to bring this under control. If there's a role for the federal money in regard to that, at least in the short term, as we develop the vaccine, that's something we're going to discuss as part of the $1.9 billion.
Si nos puede hacer el mismo comentario en español sobre el asunto de la Convención Republicana y su enfoque en estos momentos como
Mi
senador.
enfoque es 100% sobre mi trabajo en el Senado. El propósito de esta reunión aquí en el día de hoy es hablar sobre este tema de Zika. Yo realmente no he dedicado tiempo a pensar ni contemplar la convención o el proceso político. Yo participé en ese proceso, pero ahora estoy concentrándome en los 9 meses que me quedan en el Senado. Y un tema importante como este, estamos hablando de casi $2.000 millones del dinero de los contribuyentes, que se va a utilizar supuestamente para el tema de Zika, y quiero asegurarme que ese dinero se va a utilizar para Zika y no para otro propósito, y que se va a utilizar en las comunidades y en los estados y en los territorios como Puerto Rico que han sido afectados con el tema de
¿Cuánto vendría para la Florida?
spend any time thinking about the contested convention, but you sent a letter to the state Republican chairman saying you'd like to hold on to your delegates. So isn't that spending some time thinking about it? And also, what about endorsing Ted Cruz? Wouldn't that send a message
guys,
to
I'm
the
here to talk
anti-Trump
about-
folks that
yeah.
you're in solidarity with them at this
Well,
point?
as I told you guys, I'm here today to talk about the Zika issue. It's not a political press conference, so
You're an elected member of Congress. It's always political.
Guys, let's try
Senator,
to
real
keep
quick.
this on point. There's a few other
You talked about your priorities between now and the end of your Senate term. You're going to be, Zika virus is one of these that you come today for. What lies ahead for these last few months for your Senate term in terms of priorities for you? What do you see are the
well,
as
we
the
have
priorities?
we'll continue to work on the issues we've been thinking about in the past as well. We'll have some issues coming up regarding the Central Everglades planning proposal, that's critical for our state, as you're seeing communities in the state impacted by whether it's Lake Okeechobee, or unusually wet rainy season and so forth, and the impact that's had on our water quality. And then some of the national issues I remain involved in on foreign policy, the Venezuela sanctions on human rights violators in Venezuela set to expire this year. We want to make sure those are reauthorized. We're going to have a debate here over the next few days on travel to Cuba. There'll be an effort in the Senate to basically open up Cuba to full tourism. That's an issue we're going to be engaged in, hopefully being able to stop. But I don't want to see any more money flow to a repressive regime on the island of Cuba. We're obviously interested in reauthorizing the human trafficking laws that have been critical in seeing progress on preventing that horrible scourge. So we have a series of proposals that we're working on. Religious freedom, we want to continue to elevate that position and that issue before this administration. And obviously all the national security issues that we've been engaged in for quite some time and will continue to be involved in. So but we have a full plate, and as you can, with an election coming up, there'll be a couple months where the Senate's not even in session. So we have a limited period of time here in which to get a lot of things done, but I feel optimistic about some of them.
Senator, thanks. We'll take one or two more questions.
Any cooperation from the state? Is the governor involved with respect to the Zika issue?
Well, the governor, as you know, has already issued numerous declarations with regard to that and has empowered the Department of Health in the state, who was also part of this, to engage themselves in both the awareness aspect and in the testing aspect. Right now, the Department of Health of the state is conducting the diagnostic tests. And, but they themselves will tell you that there needs to be a commercial availability of the diagnostics. You need to be able to go to Quest Labs or some of these other labs and be able to get this test. Right now that's not available. And so we need to work with the FDA to expedite that process so that in fact the testing becomes not just more reliable but faster. And oftentimes they're waiting for one of the tests up to 3 weeks because it's very complicated. It can give a lot of false positives. So the state is doing what it can. I'm comfortable with the state's response. But the state doesn't have control over the FDA, and the state can't do much about commercializing the availability of the Zika testing kit. So that's one of the things we'll have to work with them on. But they are involved clearly, and in conjunction with Miami-Dade County, in a process of educating people as well about what they can do. Look, one of the takeaways that I hope you'll take back in your messaging is that while the government needs to do its part, personal responsibility here is important. That you're a senator, you're a mayor, cannot be along at your home every morning applying, mosquito repellent before you go to the beach. You've got to be able. These are things people are going to have to take upon themselves. to do, and it's important for them to do it. Having a mosquito bite is not just an annoyance because it itches. And mosquitoes don't just carry Zika. They carry a host of other very serious illnesses that man has been dealing with since dawn of time. So I hope that part of this is we're going to do our part and ensure that federal taxpayer money is being spent wisely, but it's important that people do their part to protect themselves and their families as well.
Perdón, hay un problema en español. Hay un problema y es que no solamente es el mosquito del Zika que está produciendo esa enfermedad, sino también es de transmisión sexual. Digamos, las investigaciones más recientes dicen eso. Ustedes están trabajando, digamos, en términos de concientizar a la gente y de recursos para ese tema.
Bueno, sin duda yo creo que parte de la campaña que está llevando a cabo el Estado y el condado es de informar a las personas que esa es otra manera, incluso en cual se puede transmitir el virus. Incluso el único caso de transmisión que ha ocurrido en la Florida fue a través de actividad sexual en el condado de Polk, no fue en Miami-Dade County. También es importante entender, has preguntado una pregunta muy importante, cuando estamos hablando de estos exámenes, ¿no? De este testing que se hace para el virus, no es simplemente la persona afectada, es decir, si una mujer está en estado, sino también su marido o su partner, ¿no? La persona con cual está, también tiene que llevar a cabo el examen para estar seguro que ellos no están posiblemente transmitiendo esta enfermedad. Así que es parte de la educación sobre esto y es parte de esa responsabilidad personal.
Senator, ladies and gentlemen,
This is the last question.
I was going to say thank you very much.
Oh, good. Thank you. Thank you, guys. Did you want to add something, Mayor, on the mosquito?
En español, por favor, alcalde.
Just to answer the question about the amount of money spent in Miami-Dade County. 3 months ago, look, a budget is a plan, and so it's not written in stone. And so 3 months ago, I told my deputy mayor, whatever it takes, go ahead and spend in terms of vectoring. And also, the vectoring that we do here, it's contracted out. We don't have a full staff of folks. We don't have an Air Force to do that. We contract it out, and we find that to be much more effective than having your own personnel. So the vectoring that we're going to be doing is going to be based on the demand, and obviously we're going to step it up when we have a threat. And we know that one of the ways to combat this threat is through additional vectoring. But that's, like the senator said, you're not going to kill every mosquito. It's impossible. Man has been trying to do that forever. We haven't succeeded. All right, but it is personal responsibility. Personal responsibility in your own home, because mosquitoes can breed in as little as a tapful of water. Make sure that you drain it. All water sources are drained, and that you also cover yourself, especially when you go out in the morning or at dusk when they're really active. Cover yourself, put on mosquito repellent, put on mosquito repellent on your kids, and protect yourself so that you don't get bit. And if you don't get bit, you're not going to catch the disease. And so that's why, that's something I wanted to make sure that you understand.
Las declaraciones sobre el Zika en español, por
Public is
favor.
getting this message and what resources the county has out there for us.
We're
I get emails from people who have assault in
putting
the
this
background.
message out on radio. We're putting out on metro stations, on mass transit, at the airport, in different areas, and we're actually doing door hangers on your doors so that you understand what it is that you need to do to protect yourselves. But then we're also doing the things we have to do in Miami-Dade County to do it. But again, I don't want people to panic that somehow we are in a panic situation. We're not. This is, there's about 30-something cases reported in Miami-Dade. All of them, every single one, is from an outside source. They went somewhere, came back, or have been somewhere, and now are here in Miami-Dade. There's not one case that's actually transmitted here. We want to keep it that way. And the way to do that is with education and with prevention. And I want to thank the senator for focusing on the problem, and then and ahead of time, before it becomes a big issue, and also to make sure that the money that is allocated for this purpose stays and is used for this purpose. Because Miami-Dade, the southern states, is where this mosquito resides, and wherever this mosquito that transmits this disease resides, that's going to be the places that this money needs to be spent. Here, Texas, Louisiana, Mississippi, Alabama, South Carolina. I think that it goes all the way up to New Jersey, right? And so that money needs to be spent there so that we don't have an outbreak like they're having in Brazil. And we don't have an outbreak like this in Brazil.
Los residentes que
We're going
necesitan
to
saber.
close. We're going to end the presentation. Okay.
¿Qué necesitan saber los residentes de Miami-Dade County sobre este problema de los mosquitos?
Que nosotros tenemos los recursos necesarios, pero yo estoy muy contento también que el senador Rubio está dedicado a poner más recursos del gobierno federal para este problema. Pero quiero decir muy claramente que esto no es un problema grave aquí en el condado de Miami-Dade. Todos los casos vienen de afuera, no de aquí del condado de Miami-Dade. Tenemos el dinero necesario, vamos a hacer más para fumigar ciertos lugares contra los mosquitos, pero como dijo el senador, eso es algo de responsabilidad personal. Todo el mundo tiene que tener responsabilidad para que no le pique un mosquito. Pon más repelente y también ropa, simplemente poniendo más ropa también, eso también es una manera efectiva para que no te pique el mosquito.
Alcalde, ¿y en el sistema escolar están haciendo algo específico para que las escuelas estemos seguras de que no hay agua?
Eso es una pregunta, tenemos que aclarar también para que todo el mundo esté educado en las cosas que no deben de hacer. Hasta una capa un bottle cap de agua ahí puede iniciar este mosquito. Así que en las casas tienen que quitar todas esas, donde hay agua, quita el agua.
Y en las escuelas, yo me refería al sistema escolar, si de pronto en el sistema escolar...
Algo que tenemos que hablar con el sistema escolar para que también ellos pongan eso de educación para todos los niños que están en el colegio.
Yo creo que es importante cubrir en español una parte que hablaste. Hoy en día, cuando una mujer está embarazada o tiene la sospecha de estarlo, para hacerle un examen tiene que recurrir al Departamento de Salud. El departamento hace ese estado. Quiere decir que eso es un proceso que demora. Y una de las cosas en las que el senador está trabajando es en asegurarse que la aprobación para la prueba se haga a nivel federal, para que cualquier mujer que esté embarazada o en sospecha que haya viajado pueda ir a un laboratorio y pueda hacerse la prueba como nos hacemos hoy las pruebas de hemoglobina y de todo, de una manera mucho más rápida. Eso va a ayudar muchísimo a todas las personas en este condado y eso es algo que creemos que tenemos que darte las gracias públicamente, porque para las mujeres de este condado, para las madres, para las abuelas que tienen hijas o nietas embarazadas, es importante pensar que pueden tener el acceso a hacerse la prueba inmediatamente y saber el riesgo que puede tener la criatura, que es algo que hemos visto y que nos oprime el corazón de ver los casos que hemos visto sobre lo que causa el Zika con esa criatura.
¿Y eso sería con los fondos federales?
Bueno, el fondo federal se utiliza primero el FDA, el Departamento de Federal Drug Administration, es el que tiene que aprobar no solamente una vacuna eventualmente, sino también la prueba que se utiliza para identificar esto y que se puedan convertir comercialmente. En este momento, si alguien quiere una prueba, tiene que ir al Departamento de Salud. No lo puede recibir de su propio médico, tiene que ir a través del Departamento de Salud. Y eso hay que cambiarlo, y ellos mismos lo dicen. Así que eso es importante y eventualmente también los fondos se tienen que utilizar para crear la base, lo básico necesario para llegar a una vacuna, que últimamente lo que debemos llegar es una vacuna para prevenir que esto se pueda seguir llevando a cabo. Si tienen preguntas técnicas o médicas, tenemos los expertos aquí que pueden hablarles sobre la enfermedad. If you have any technical medical issue questions about transmission risk, etc., we have experts here from the department, healthcare experts that can answer more detailed questions with regards to that. But thank you guys for being here today.